Well, anger over new COVID restrictions has led to protests across Europe, some of them violent. A nationwide lockdown has just gone into effect in Austria, with a vaccine mandate expected in February. In Croatia, thousands rallied against mandatory vaccine certificates and other health measures. Police in Brussels used water cannon to disperse protests against a plan to ban unvaccinated people from some venues. And in the Netherlands, a partial lockdown is underway. Many people already were frustrated by months of restrictions, and they are lashing out. Well, for more on this, we want to bring in Geir Rijkers, a professor in biomedical and life sciences at the University College Roosevelt. He joins me now from Tilburg in the Netherlands. Thank you so much for being with us.
Thank you. Good morning.
So, all the data and all the evidence shows that these COVID vaccines work, and yet so many people across Europe and indeed the United States are pushing back, while people in poorer nations would probably do anything to get access to these same vaccines. Why is there so much resistance to these shots, and how do you overcome this anti-vax sentiment?
And that's a good question, also a difficult question. It is not one coherent group that refuses vaccination. In the Netherlands, we have at least three different reasons not to vaccinate, not to become vaccinated. One is based on religion. In our so-called Dutch Bible Belt, there's a general low uptake of any vaccine, including the corona vaccine, so that's one. Then we have people with a migration background who hardly speak Dutch and live in certain areas. There's also a low uptake. There's certainly distrust. Latest what I heard was that Somali women said that if they would get vaccinated, that was meant by the government to kill them, active kill them. So that's really almost incomprehensible. And then we have the anti-vaxxers who, on all kinds of weird reasons, conspiracy theories of Big Pharma, of Bill Gates. Well, you have the same in the US. And that is a very vocal, active group who will flat out refuse no matter what you try.
Yeah, misinformation being right at the centre of all of that, apparently. And of course, scientific evidence is now showing that a third booster shot is the answer to stopping COVID in its tracks. What's your view on getting those open to being vaccinated, that third booster shot, given it was just approved here in the US for all those adults 18 and over?
Yeah. We are a bit late. We have just started with the 80+ group to get a booster vaccination. I think that most people that did get 2 shots also want to take 3 shots. But the argument that you would need an additional shot is also used by the anti-vaccine movement. Let's say it shows again that the vaccines don't work. And now they want you to take a 3rd shot and maybe a 4th and a 5th. Where is the end?
Right, and of course, now there's a treatment. These COVID pills will become available to most people eventually. How confident are you that the various COVID pills, because there's a couple of companies that are putting these out, they're being approved, will they help those who resist the vaccine? And could those pills eventually turn this around, along with the vaccines, of course, for those people who have accepted the science on this?
Yeah. We'll have to see, of course, how effective those 2 pills will be in real practice, but I have good hopes that it is effective. For the religious group that refuses vaccination, they do accept treatment, so for them it will be good. Also, of course, for everyone who is vaccinated, but because of their weak immune system, they still could be vulnerable. That is good. And I assume that everyone wants to remain healthy, and that if you are opposed to vaccination, you still will go to the hospital or to your general practitioner and have yourself treated. So I think that adequate treatment now for this horrible disease will certainly have its impact.
Let's hope people can be smart and turn this around. Geir Rijkers, thank you so much for joining us. We appreciate it, and you. Thank you.
Okay, thanks.
Well, vaccine misinformation is taking a tragic toll in much of Eastern Europe too. Vaccination rates are lower there than in Western Europe. The problem is especially acute in Romania. With just under 36% fully vaccinated, it has one of the lowest vaccination rates in Europe, and it's suffering one of the highest mortality rates in the world, something sadly evident in hospitals and morgues across the country. CNN's Ben Wiedemann joins me now from Bucharest, Romania, with more. Ben, we've been seeing a lot of anti-vax sentiment across the globe, but it appears particularly evident in Romania, or there could be other contributing reasons for why the vaccination rate is so low. What are the main reasons for this resistance there?
Yeah, Rosemary, it is a lethal combination of fake news, misinformation, superstition, and suspicion, all of which have been stoked by some religious figures as well as politicians who are basically taking all of those factors and making them even worse. Now, this despite the fact that Romania actually got off to a pretty good start with its vaccination program last year. But as you said, Romania now, among European countries, has the second lowest vaccination rate just after Bulgaria. Now the numbers are starting to go down. This is Romania's fourth wave. The numbers are starting to go down, and that ironically has prompted the cabinet, which is actually a caretaker cabinet composed of a rather shaky coalition, to consider the possibility of relaxing some restrictions. Clearly, they're concerned about the sort of unrest, the opposition that has come from the streets in Western Europe to stricter measures. So it seems that they're putting politics before public safety when it comes to trying to bring this pandemic under control. Rosemary?
All right, Ben Wiedemann bringing us the very latest from Bucharest. Many thanks.